Welcome to the second session of our 2021 conference. My name is Spencer Wall, and I am part of the benefits team here at Beehive Insurance. This webinar is sponsored by SelectHealth, and we would like to extend our appreciation to them for their support and partnership. Our presenter today is Dr. Roy Gandolfi. Dr. Gandolfi is a medical director at SelectHealth. His responsibilities include developing and implementing medical policies. He is a practicing internist in Salt Lake City and is committed to helping people live the healthiest lives possible. Dr. Gandolfi is deeply involved in genomic utilization. He received his bachelor's and medical degrees from the University of Michigan. He is an adjunct associate professor of medicine at the University of Utah School of Medicine. His remarks today will be focused on preventative medicine, and I will now turn the time over to him.
Welcome. I'm Roy Gandolfi, one of the medical directors at SelectHealth. I have been given the opportunity to give a review of preventive medicine and how it applies to current healthcare needs and requirements. The discussion will first define what preventive medicine is. Secondly, why is it important in this current state of healthcare policies, including the Affordable Care Act requirements? Thirdly, how current preventive guidelines are developed. Fourthly, how do payers and different states address preventive medicine? And finally, what is on the horizon for potential new tests in preventive medicine? Preventive medicine has its foundation to detect disease before there are symptoms of a disease. The presumption is that this will improve the future health of the individual. Overall, we know that life expectancy since the early 1900s has increased dramatically up until the recent pandemic of COVID-19. One of the keys to this success is preventive medicine. Preventive medicine prioritizes healthcare problems and finds areas of medicine which will also have effective interventions. Preventive medicine may be a test, a therapy, or counseling. Despite the goals of preventive medicine, the application of preventive medicine surprisingly has not shown definitively to change outcomes and survival. Systematic reviews of preventive medicine have shown variable results. But obviously, these results need to be interpreted cautiously. The questions remain. Is the lack of definitive improvement related to the disease process, the therapeutic intervention, or even the compliance of both providers and patients to follow the recommendations? It is important to address the difference between preventive medicine and screening tests. Preventive medicine has followed specific principles to identify a disease and verify through literature that a public health concern is present and that a member can be identified early in a disease, which potentially can have dramatic effects not only on the quantity but the quality of life for that individual. An example of confusion is the US Preventive Task Force has summarized that testing for vitamin D has no long-term health benefits. This is contrary to what many practitioners and patients believe. Here, lay press has dominated the landscape while medical literature has tried but failed to demonstrate that vitamin D testing in an asymptomatic patient is helpful. Also, a screening test may be medically necessary but not meet the rigor or evaluation of a preventive test. Other important aspects between screening tests and preventive tests is preventive medicine is covered 100% by the payer, and covered screening tests would be allowed under the medical benefit. Other important concepts of preventive medicine need to be addressed. First, preventive medicine needs to include good communication to patients. During the discussion of primary care's office, it is important to discuss the risks of doing tests as well as the benefits of the intervention. One clear example of this is lung cancer has such a high mortality rate that anyone would think that someone would follow the recommendations of annual CT scans to detect asymptomatic lung cancer in someone who smoked. Unfortunately, we have to remember the radiation exposure over numerous years that could increase the risk of cancer, and that this test clearly may have false positive results, subjecting the individual to further testing and even significant invasive procedures to make a definitive diagnosis. Secondly, potential overuse of testing. It also has come to light that despite the recommendations by organizations, too often unnecessary screening is done. Most experts agree that patients have an estimated greater than 10-year life expectancy should undergo the preventive test recommended by the U.S. Preventive Task Force. Unfortunately, in this world of stars for Medicare, either from the Affordable Care Organizations or MedAdvantage plans, providers are commonly met with the need or requirement to maintain or increase the rate of acceptance of preventive tests and may ignore the above recommendations, potentially increasing harm to the member with unnecessary testing. One would think that even annual visits would have been able to show or demonstrate enhanced healthcare outcomes, but clearly the frequency of standardized visits has not been established. Even an annual wellness visit deemed a requirement by Medicare has not been shown to improve health outcomes. It is now recommended, though, that over the age of 50, an annual visit is recommended, and under the age of 50, every 3 years can pass before a visit to a primary care physician. But overall, it was not until 1984, with the U.S. Preventive Task Force formed under the guidance of the AHRQ, that the premise of preventive medicine and a rigorous standard for identifying and evaluating and implementing the recommendations started. The keys for the U.S. Preventive Task Force are transparency concerns, a rigorous evaluation of the disease, available therapeutic interventions, and potential improvement in life and longevity for those individuals who have a lack of symptoms of a significant societal health concern. The foundation of the preventive medicine by the U.S. Preventive Task Force is the avoidance of the development of disease or even secondary prevention to treat an existing disease before significant symptoms arise. The preventive service may be a test or a medication or even counseling, as I mentioned before. It should be provided or referred by a primary care physician and have significant public health importance and affect clinical practice. The Affordable Care Act requires that health insurance require coverage at a preventive benefit and must use the U.S. Preventive Task Force AB recommendations and must also follow the recommendations from the CDC for immunizations and follow guidance of Bright Futures for pediatric care and Health Resource Service Administration guidelines for female health. The U.S. Preventive Task Force follows the rigorous process described below. The key fundamentals are, number one, identify a disease which will impact societal and members' health. The patients must be asymptomatic. They have to do a thorough review of the literature. A therapeutic intervention needs to be available. We must determine the risks and benefits to the patients, communicate the process well, and that primary care needs to be the driver of the intervention. And cost of the test plays no role in the determination. Following are the health grades of the U.S. Preventive Task Force. There are multiple grades on a specific topic, and they may have specific subpopulation recommendations. The task force may issue a grade of A through D and I when there's insufficient information. The table below lists how to interpret the task force recommendations. Specifically, A, the U.S. Preventive Task Force recommends a service. There's a high certainty that the net benefit is substantial. Or in B, the U.S. Preventive Task Force recommends the service. There's a high certainty that the net benefit is moderate, or there is moderate certainty that the net benefit is moderate to substantial. You can follow the other recommendations in the table for C, D, and of course, I. Table 5 shows the magnitude and certainty of the test. But we must remember only A and B recommendations are required to be covered by an insurance plan per the Affordable Care Act. There are numerous tests that the U.S. Preventive Task Force has evaluated. The guidelines highlight the following areas: cardiovascular disease and recommendations about diet, counseling on the cessation of smoking, evaluation of blood pressure and high cholesterol, counseling on exercise in regards to obesity and diabetes. Other areas of high concerns are assessing cancer risk, including cervical and breast evaluations, which discuss the specific type of test and the frequency of testing. Several new recommendations have been issued in 2021. To me, the most important modification is the lowering of the age to 45 for a preventive colonoscopy for those individuals who have an average risk of developing the disease. One can access all the studies easily by going to the U.S. Preventive Task Force website. I now would like to address future tests that the U.S. Preventive Task Force may evaluate in the future. The discipline of genetics and the increase in overall health risk for those individuals who may carry a familial trait. This trait may predispose them to cancer. A one-time whole genome test, which would evaluate an individual's risk for developing hereditary breast cancer or colon cancer, could be life-saving to an individual even before routine preventive tests may detect a new cancer. But one must realize that typically hereditary breast cancers occur in less than 5 to 10% of those individuals who eventually develop breast cancer. The same also applies for colon cancer. But having this trait, for example, with BRCA mutation, may increase your risk for lifetime development of breast cancer to 70%, compared with the norm of 10 to 12% in a woman with normal risk. Of course, any type of recommendation would have to be based on the prevalence of the disease, impact to the individual, as well as the potential anxiety of a recommendation for undergoing any type of prophylactic care, including a mastectomy or removal of the ovaries. With the dramatic decreasing cost of whole genome testing, future discussions of genetic testing as a preventive benefit will undoubtedly be evaluated. But even what is more compelling would be a test to evaluate for a new cancer through a simple blood test that could be done every 2 years. The FDA is currently evaluating a test from Grail Laboratories named Gallery. This measures cell-free DNA from a cancer anywhere in the body. The test measures a chemical process called methylation, and cancer cells have an increased rate of methylation. What is even more phenomenal is that the test can differentiate the type of cancer in the body. The premise of the test is to detect cancer sooner before it metastasizes. By doing so, we would be able to detect cancer at stage 1 or stage 2, where typically surgical intervention or lesser amount of potential toxic chemotherapy would be administered, and the patient would have a greater life expectancy, as well as have improved quality of life by this early detection. Intermountain Healthcare is considering adding this test to its benefits for any employee over the age of 50 at a frequency of every 2 years. It has not yet been determined whether this will be a preventive test or covered as a medical benefit. What would I do if I was a patient? In my office as a practicing internist, I request all my patients follow the U.S. Preventive Task Force recommendations, but I individualize the discussion depending upon the life expectancy of the individual. To me, mammograms and colonoscopies are clearly life-saving. Clearly, this is an exciting time in medicine. I hope that this discussion has enhanced your understanding of the purpose, development, communication, and the potential future of preventive medicine. Thank you.
Thank you, Dr. Gandolfi, for sharing your expertise with us today. It is exciting to hear about the new cancer testing abilities that are being developed. And thank you to all of you for joining us today. Please make sure you RSVP for next week's session. Have a great day.